experience with biomeshes, and the bovine collagen dermal matrix made by Integra, the Surgimend, seems to work well with the cyanoacrylate glue. And this is a laparoscopic repair. The defect's been closed. It's an epigastric hernia, higher risk patient. That's why we're using a biomesh. This biomesh, you cannot tack through it, even though it's the thinnest 1 millimeter thickness. You cannot tack. You have to suture the mesh, and that is quite laborious when you're doing a laparoscopic repair. So with the glue, it works well. And you can see we're just spreading the glue as a sheet of glue, as a film of glue, to get good surface contact with the peritoneum. So I think the surface area for contact, for adhesion, gets a better adhesion. And that also helps with the biomesh integration as well. So that is a biomesh repair, laparoscopic IPOM. And we've recently published our early data in hernia in February of our first 137 patients. And these were predominantly midline repairs, not huge defects, mostly median diameter of 5 centimeters transversely. We closed most of our defects at over 3 centimeters. And it was a combination of experience with Symbiotex, some Dynamesh, and the bovine collagen matrix Surgimend for higher risk patients. And in a third of patients, we actually fixed the mesh to the diaphragm using the glue. These were for upper abdominal, right upper quadrant hernial defects. And again, our adverse event rate was low, very few seromas. And I think that is related to the fact that we can close the space between the mesh and the peritoneum very well with a film of glue. Low rates of hernia recurrence, and that may well be because we've got a lot of fixation, and low rates of chronic pain. And that median follow-up was 32 months and follow-up up to 4 years for those patients. So I think for laparoscopic IPOM, it is a good way to fix if we're going to use an IPOM technique. And it reduces pain, it reduced our length of stay. We could fix in areas which are difficult, such as the costal margin, the diaphragm, over the pelvic floor. Biomeshes are good, especially the Surgimend is good to use with the glue. And we have low rates of adverse events. Now, we're also using it in our open abdominal wall reconstructions, and I use it to fix mesh, both prosthetic and biologic, in the retrorectus position. And that saves a lot of suturing and issues with what's underlying that, the posterior rectus sheath. We also use it to obliterate the dead space between the mesh and the defect closure. We also use it for intraperitoneal biologic mesh as well, to bring it up to the peritoneum after doing stay sutures. And we've started to use it now in perineal hernia repairs to fix the pelvic sidewall, which is a very difficult area to actually fix with sutures.